Hello, everybody. I'm here in my pre-op. Like, tell everybody hi. And they're getting everything together for me so that we can have this working out really good. So this is the second pre-op I had to go to today. The doctor's gonna come in, so I'm just gonna set the phone down like I did before. But this time I won't be upside down. So, yeah, they're just gonna tell me the do's and don'ts, what I need to do, this in the surgery part of it. And then I got one more pre-op. So I got like 3 pre-ops since I'm doing a combo. And then the other pre-op is on Monday. So that doctor will tell us what he wants us to do. So I'll be back.
Rita.
Hi.
Hi, and family. Hi. I'm Dr. Ash, the medicine doctor.
Oh, okay.
Welcome to
Nice
the
to
pre-op
meet
clinic.
you.
Nice to meet you. This is your first visit here, correct?
Yes.
All right. Well, I'll give you our little disclaimer. The purpose of the pre-op clinic is to get you as safely as possible to your scheduled procedure. Very occasionally do we have to delay surgery for additional testing, treatment, things of that nature.
Okay.
But as of now, we have you scheduled on May the 2nd with Dr. Sanders and Cohen to have an abdominal hysterectomy and panniculectomy. I can never say that word. Does that sound correct?
Yep.
All right, very good. Okay. So a little medical history to go through, not too bad. But I understand you've got some very large fibroids that have been giving you problems.
Yeah, that's what they found out.
Goodness, okay. And you've had some heavy bleeding and
No, I didn't have none of that.
Oh, no?
They're
Okay.
on top of the uterus.
Oh, okay. But probably painful at least. And
Yeah, I didn't really know that that's what it was, but
okay. Yeah.
But they said they're kind of touching on the organs and
Yeah,
stuff.
at some point if they keep growing, I'm sure they'll cause some even more problems. So.
Right.
Yeah. Okay, so listed medical history that I have here is you've had a hiatal hernia, you had a gastric sleeve. When was that surgery done?
2018.
Okay. Did you do okay after that?
Yeah, I did great. Well, that's when they realized I had a hiatal hernia.
Gotcha.
But it hasn't been fixed though.
It hasn't, okay. Sometimes you really don't have issues with it, so hopefully that's the case. And then you lost about 100 pounds, still lost about 60 overall with time and everything. History of anemia, which your blood levels look pretty good today.
Yeah, I had Dr. Cohen had me do my infusion. I used to get the blood infusion injections.
Oh, the IV iron? Or
yeah, I get that like twice a year.
Do you? Okay, all right.
So it keeps me kind of level.
Exactly, it's doing a good job, so. And then you've had a blood clot in the past.
Yeah, I got it from traveling.
Okay, and it was like long travel to Africa is what Angie was telling me. So yeah, certainly a long plane trip.
Yeah. And
that's the only time you've ever had a blood clot before.
Exactly.
Okay.
I didn't know I was supposed to get up and walk around.
Yeah. Well, it's.
They
don't do a good job of telling people.
They
that.
don't.
They really don't.
I've seen people walking around. I'm like, why don't they sit down?
I know.
But I realize now what they were doing.
Yeah. Yep. Okay. And then, do you still smoke?
No.
Okay, quit doing that? Okay, excellent. Good, all right. Is that kind of sound like the whole medical history? Not just
everything sounds great.
Okay. To your knowledge, you've never had any issues at all with your heart? You've never had a heart attack or an abnormal heart rhythm?
No.
Okay. Lung disease like asthma or COPD? Okay. Liver problems?
No.
Kidney problems? Never had a seizure, never had a stroke?
Never.
Never been told you have sleep apnea?
Nope.
Okay, fabulous. Previous surgeries, have you had, obviously you had the gastric sleeve done. Many more surgeries?
Just the gallbladder removed
Okay.
and my trigger finger.
Okay.
That was it.
Any complications with anesthesia with any of those?
Nah, I woke up, they knocked me out,
Okay. Weren't nauseous, vomiting, or anything like that afterwards?
No, none of that.
Fabulous. Does anything in your normal daily life cause you to have chest pain or shortness of breath?
No.
Okay. All right. Your EKG looked great.
Oh, good.
And overall, your labs look great. So.
Okay, great.
Let me take a quick listen to you here.
All right.
And that blood clot was in 2018.
Yeah,
correct? Okay.
uh-huh.
How long was that after your surgery, or was it before your surgery?
My surgery was in April, and I traveled to see him in September,
Okay.
and I came back in October, and that's when
I was on the way
I'm
back.
way back home.
Oh,
Uh-huh.
goodness. Okay.
Yeah.
Okay. I'm gonna take a listen up here on your neck first of all. That's good. Okay, sounds great. A couple of deep breaths in and out. Fabulous. Okay. All right, my dear. Well, I see absolutely no reason why you cannot have this surgery done.
All right.
It looks like they are already planning for you to be on the blood thinner injections afterwards with this history of blood clot, which I think is a very good idea.
Yeah.
So 2 weeks. Do you have any issues with needles or injections?
No,
or
I
anything
should
like
be
that?
okay.
Okay. Good, good, good. All right, my dear. As far as medications we need to adjust beforehand, we really don't have anything we need to stop like way ahead of time. Do you take like a multivitamin or anything like that?
No.
Okay, okay. Try not to take any ibuprofen, Aleve, anything like that for about a week beforehand. I don't know if you do or not.
Okay. Well, I do take was that a Cedrin? Is that okay?
Sometimes those have ibuprofen in them.
Okay.
So try not to. If you need something for pain, Tylenol, just straight up Tylenol is safe. That won't cause you to have any major bleeding issues.
Okay, sounds good.
Okay. All right, my dear. Well, hang out here for just a second, and we'll get you out the door.
All right, thank
Okay,
you.
Thank you.
Anything I need to do before or anything? I come in?
She's probably going to give you a bath to do, a HIPAA bath.
Okay, yeah, I did that before.
Okay.
I had Mercer a long time ago.
Yeah, but that's really about it.
Okay, sounds good.
Okay, all right.
Thank you. Hello, everybody. I'm here at my my third pre-op, my last pre-op. Baby, tell everybody hi. We about to get it done. I'm waiting on this doctor to come on in. Don't forget to like and subscribe my channel.
These medications are safe.
Yeah, I'm gonna set the phone down. Same thing I did before. They got me watching a video.
Very effective in controlling pain.
My husband got it playing on his
And most
phone.
importantly, can reduce your need for narcotic pain medicine.
So I'm gonna watch the video and everything, and I'm gonna keep y'all posted, and y'all just listen in and everything. All right. Yeah, just the last one. 2 more weeks. 2 more weeks. All right.
Speak good English.
Anywho. But what happened was, no, I thought this last pre-op would be for my just to talk about what's about to happen so I can have myself mentally prepared. But I didn't think I was getting no exam or nothing.
So we usually need to do an examination just prior to the surgery to make sure nothing's different than when I checked on you back in January for your annual exam. So it's typical for us to do an examination within, because we usually, number one, to make sure nothing's different, but two, we have to document, well, what did we find within the last 30 days? Because if anything is different than what we noticed in January, it could change how we do our surgery.
Okay.
Now, so that'd be the purpose of our examination today. We also need to have you watch the, did you already watch the ERAS video?
Yeah, we watched it.
Where'd you watch that? Just here?
Yeah, she just gave us the...
Oh, the
scan
link on your,
code.
okay, all right, very good.
Yeah,
We
we
usually have
watched
it set up in there.
No, we
on the
scanned it
computer.
and watched it. But see, I'm on my last cycle.
Well, are you enjoying it?
I'm kind of like feeling some kind of way.
In what way? What kind of way?
Like, it's my cycle. This is my last cycle. Well, what I'm gonna feel like next month. Just kind of like...
Sure. So
You know?
what's important to know is that your ovaries, our goal is to leave them behind, right? We're gonna take so as a review of the surgery, because your your plastic surgeon and I have been communicating with each other about what he's gonna do
That's nice.
and what I'm gonna do.
Mhm.
So he's gonna start your surgery because there's enough skin that he needs to take off, right? And then I am gonna take over and do the hysterectomy part, and then he's gonna put you back together
Okay.
from the inside out. So our goal is gonna be to do the hysterectomy and take both of your tubes out, but leave your ovaries behind. So that takes away your bleeding, because it's gonna take away your uterus and your fibroids, but it does not take away your hormones. Now, a lot of women will go through kind of a transitional menopause state, because if you look over here, what you don't see is like the blood supply to the organs. But coming from this way and coming from that way are some blood vessels that the ovaries and the uterus share, so on both sides. And so when we take out the uterus, sometimes the ovaries kind of freak out a little bit, and they, a lot of women have like some hot flashes that they weren't having before, as bad as some mood swings that they weren't having before.
So where is it going?
What do you mean?
Where, if they have veins connected,
Yes,
you're gonna disconnect them,
correct.
and then it's just gonna be out there just floating around?
What?
The vein that was attached from
No.
the ovary to the uterus, what happens to them?
So they will just eventually make their way back to helping the ovary.
Okay,
Yeah.
but during that
Because
process.
that's not the only supply for the ovaries.
Okay,
So
okay.
the ovaries have their own blood supply, and the uterus has its own blood supply. But then they just share some because they're so close to each other.
Now, based on my ultrasound,
Mm-hmm.
did you see any of these fibroids fused onto any other organs based
So
off my ultrasound?
We couldn't see it on anything like that on ultrasound, but ultrasound usually doesn't show us anything like that, because it's just like looking at a picture, like a flat picture. It's a 2D. It's not going to show us everything that we need to see. So it can't, and it doesn't look at the surface of organs as well.
Okay,
It can look at surface of organs, so we can see like the outline of the fibroids, the outline of the uterus, outline of the ovaries, but it does a better job for us for looking at the inside of the organs.
oh,
Um,
because the pre-op lady that I went to Wednesday,
uh-huh.
not for Dr. Coleman, but just for the surgery part,
Yes,
they were saying that my husband might have to sign off on some stuff if you find something.
so,
Once you open me up,
yeah,
and I'm not able to give the okay. Like if you found they had to remove one of the ovaries and that wasn't part of the plan because of something.
sure. So what's on the consent form will be the abdominal hysterectomy with a bilateral salpingectomy. That's taking the uterus and the tubes. We go in knowing, because that's what I write down.
Mhm.
On the consent form, there's other language in there that pretty much allows us to do things that are necessary in order to complete the case. So it wouldn't be that we'd have to call him and say, hey, we found this. Do you think it'd be okay if we do this?
Right.
We go in knowing that that's a possibility,
Ah.
expecting to be able to leave your ovaries behind. But like we talked about when we were scheduling this whole thing,
Yeah.
that if the ovary is attached to one of the fibroids, especially that big one, that we might have to lose one. But if we have to take one, we'll definitely do our best to leave the other one behind.
Okay. Now, how many eggs you think is still in there? Based off my age.
There's no way to tell that.
Okay, but I still should have a couple in there.
There'll be a few. Do you plan on using them?
I wanted to harvest them one day
For what?
for a surrogate. I'm keeping my options open now.
Okay.
I'm keeping my options open.
You can do that.
And that's the whole, want to have a talk to make sure I know what I'm telling these people, that I know I got still something in my body.
So the only thing that we can tell you is right now you're premenopausal. So as long as you're premenopausal, your ovaries will be functional. And that's what I was going to get to when it comes to your cycle. I know you're feeling some kind of way about this being your last period, but your cycle will still be happening. So as long as you have ovaries, as long as you're premenopausal, the cycle will continue. So
The
if you
egg
have,
just ain't going nowhere.
Well, the eggs are going somewhere. They're being released into your abdomen.
What?
They're already being released into your abdomen. The fallopian tubes just grab them before they go anywhere else, essentially. So they're single cell structures. So it's not impacting anything.
I didn't know that.
Yeah. So they'll still be, if you're still young enough to have a cycle, then you're still young enough to release an egg.
Okay.
And so how many eggs you have, that's impossible to say.
Right.
If you ever got to the point of wanting to do that sort of thing, you'd have to talk with the reproductive endocrinologist
Right.
about how that goes down. But what you end up doing is stimulating, and they usually are doing this in people who still have all their lady parts, because it helps with their process, their procedure, kind of knowing where everything already is.
Right.
When you get a hysterectomy, things can get displaced, meaning the ovaries are typically sitting behind the uterus when you're laying down. The uterus won't be there anymore.
So they could be anywhere.
Well, they'll still be on the sides. So not everybody is made the same, but everybody is similarly made.
Okay.
And so where they would potentially aim for or look for where these structures might be, they may not be there. Then it's, where are they? What do we get? How do we get to them, et cetera.
Okay.
Now, that was a conversation you were supposed to have with me in January.
We did.
Kind of. We didn't really talk about
No, you shut me
surrogacy.
down by you 48 years old and you really I was like, dang. And stole my joy. But that's okay. We did talk
You
about
asked
it
me
in
about
January.
pregnancy.
Yeah,
Not
because
about
I was
surrogacy.
unsure if I was gonna do the combo. Remember?
We didn't talk about surrogacy. We talked about pregnancy.
Right.
That's a whole different conversation.
Yeah, I had to change my mind when I decided to do the combo.
Yeah.
Because I didn't know if I
And
was
that's
gonna do the combo.
That's understandable. I understand that.
I wasn't gonna get this done. Remember?
I do.
I wasn't going to. But it made sense.
I know.
Especially since you said it's still growing.
They're
The
not going
fibroids
to
is-
stop.
Exactly.
Yeah.
So that was my concern there. And then I guess my next question will be, how long?
For
They got me down for 5 hours.
the surgery?
Mm-hmm.
Okay.
My one girlfriend, her hysterectomy, she said she was in there 2 days. I mean, but that's all they got. I don't know nobody that got a combo like I'm getting.
Yeah.
Dr. Cohen said a night and a day. I mean, am I a night and a day? Is that what it is?
If you're feeling good enough to go home,
Okay.
I don't see any
So-
reason to keep you.
He said about.
So we're doing it on the 2nd.
Uh-huh.
So if you're feeling good enough to go home on the 3rd, go home.
Okay.
Otherwise, stay till the 4th.
Okay.
But frankly, his surgery is a lot more involved than my surgery.
Right.
Because I'm just getting in there, getting your uterus out.
Now, are you the one stitching my muscle back together?
He's doing that.
He's doing that too. So I need photos
Okay.
of my uterus and my fibroids. Because technically, my mind, I ain't gonna lie, still say, why can't the fibroids just be cut out and I keep my uterus?
Okay.
That's what my mind is saying. But I know you know best because you're the professional.
Yeah. I know what you know best for you. If you want us to change it to a myomectomy, that'd be entirely up to you. And this is what we were talking about with pregnancy.
Hmm.
Because you only have a short window.
Exactly.
Like your menopause is coming, period.
Yeah.
When that comes, it depends on the individual. And frankly, it depends on your genetics. But that window is really short. So we do the myomectomy if that's what you want to do. But then you have to wait 6 months before you can even try to achieve a pregnancy.
Mm-hmm.
And then y'all need to go to a fertility specialist
Like right at ASAP.
at 6 months and 1 day.
Mm-hmm.
Because the time is really, really short.
Okay. I just need pictures of the.
You got till the 2nd.
No, I'm okay. I'm
Okay.
okay. That's why we have all these pre-ops. I guess I can get everything out
That's
right
why we
now.
talk.
Yeah, so I would like pictures of my uterus and of my fibroids. I would like to see them. I want to
Okay.
see my stuff.
Make sure you say so on the 2nd.
I will.
Yeah.
I will. And then, babe, what's the other question?
The soap you simply gave me.
Oh, they gave me
Sugar.
some Hibiclin.
Yes.
What you want me to do?
They didn't tell you?
Well, she didn't think she mentioned it.
You might need it.
She said I might need it, but it depends on y'all. So she
So-
gave it to me.
It really would be up to Dr. Cohen.
Okay.
Because if it was just my surgery,
Mhm.
if I was just doing a hysterectomy, I wouldn't necessarily require that.
Right.
We do recommend it for some folks. If he wasn't doing his thing, I'd be making a vertical incision. And that vertical incision would be exposed, so we wouldn't have as much to worry about as far as infections go. For other folks who are doing a horizontal incision, it sometimes gets hidden underneath the skin if we're not doing the panniculectomy like you're getting.
Okay.
And so that puts it at higher risk for getting an infection and things like that.
Okay.
Yeah.
That makes sense. All right. So what do you want me to do, like, to prepare myself?
What do you mean?
Like anything, my diet, anything, everything
That's
goes.
what it was. That's what it was.
That's the whole point of watching the video.
I watched the video, but you know the video
You
wasn't
getting
like.
nervous now,
Yeah, I am.
huh?
I am.
Everything we want you to do is in the video.
I watched the video.
Yeah.
Watch it again then.
Yeah,
You have to
watch
link.
it again.
Watch it 2-3 more times.
Okay.
Because everything we want you, that's the whole point.
Yeah.
Yeah, but the video wasn't detailed. It didn't show nobody's ovaries getting taken out or nothing like that.
No, it's not a surgery
it's
video.
not surgery.
Yeah.
It's getting you ready, what to eat, what time to eat, what
Okay.
not to eat,
Yeah.
you know.
Okay, so that sounds good. So what do you want from me? What do you want me to do now?
Today we do need to do a pelvic exam.
Okay, well I'm gonna need some more tampons because I ain't bring nothing. I ain't
You're a
think I was gonna need-
gynecology office. Record this. If you go to a gynecology office and they don't have tampons, you're in the wrong gynecology office.
Sounds good. Okay, well I'm gonna get undressed to do this part
Yeah,
and then
use that pink sheet. Here, you can take this.
so we can do what we gotta do.
If you're bleeding, you take this and put it on you.
Oh, on the
Sit
bottom.
on it.
Okay, got it.
But use that sheet up there to cover your waist up.
Got it.
Remember how you did for
Okay, y'all heard everything. It's going down. I'm about to get my last exam. They gotta see what's going on. Yeah, I'm getting nervous, y'all. I'm getting nervous. I'm gonna keep y'all updated. We only got 2 weeks before the surgery. They doing a lot. My husband got my back though. And we're gonna be all right. Y'all take care, and I'm signing out. All right. Y'all got any questions, y'all ask me. I'm gonna tell y'all what's going on.